Adrian here. Welcome to my English Corner. Today we're going to be talking about visiting the doctor. Whenever you feel sick or unwell, we will go to see the doctor to get some advice or some medicine to help us to get better. Let's take a look at our first screen. First of all, let's take a look at some different people who work inside a hospital. These are different hospital staff. The names of these people are at the bottom of the screen. Let's match these words correctly to these pictures. Before we do this, let's just read out each of these words first. Starting from the left-hand side, this is a pharmacist, pharmacist. Surgeon, surgeon. General practitioner, general practitioner. Nurse, nurse. Radiologist, radiologist. Optometrist, optometrist. Dentist, dentist. Pediatrician, pediatrician. Okay, so these are the different hospital staff. Let's see if you can match them to the right pictures. If you want to try yourself first, then pause this video now and you can have a go. Okay, let's have a look together. Picture A. Who is this man? He is the general practitioner. Picture B. Who is this? He is the dentist. How about this girl in picture C? Who is she? She is the nurse. Over here, picture D. This man is the surgeon. Picture E, holding the baby. Who is this woman? She is a pediatrician. Next to the pediatrician, this man, who is he? He is the pharmacist. Picture G is the optometrist. And the last picture, this woman, she is a radiologist. Okay, so these are some of the different hospital staff that you might see when you visit the hospital. But what do these people do? Do you know? Okay, let's talk about what they do. First of all, the general practitioner. So basically, the general practitioner is the doctor that you would normally see if you have some basic health problems. For example, if you have a headache or a stomach ache or something like this, you would go to see the general practitioner. They will ask some questions about your problem and your condition, and then they will try to give you some advice and maybe prescribe you some medicine to take to get better. How about the dentist? What does the dentist do? So as you can see in the picture, the dentist is a special doctor who treats problems with your teeth. If you have a toothache, then you would go to see the dentist. The nurse. Okay, what does the nurse do? The nurse works in the hospital, and the nurse's responsibilities include taking care and looking after patients who are recovering in the hospital. Sometimes they might need, for example, injections or things like that. The nurse will take care of this. The surgeon. The surgeon is a very special doctor who carries out operations. So people who have some more serious health problems, for example, if they need some kind of transplant, like a heart transplant, then the surgeon will be the person who will conduct this kind of operation. The pediatrician. So as we can see in the picture, the pediatrician is holding a baby. So that means pediatricians, they specialize in health problems related to children. The pharmacist. So when you want to buy some medicine or after going to the doctor and the doctor gives you a prescription, then you will go to the pharmacy, the drugstore, where you will see the pharmacist. So the pharmacist is the person working in the drugstore, and he will select the medicine that you need in order to help you to get better. Picture G, the optometrist. What does the optometrist do? This is another special doctor who specializes in eye problems. So any conditions related to your eyes, then the best person to see is the optometrist. And the last doctor, the last person here, is the radiologist. And in this picture, we can see the radiologist holding up an X-ray scan. So the radiologist is in charge of helping you to take X-rays and then analyzing the X-ray scans to determine what the problems are. Okay, so these are the different kinds of hospital staff. Let's carry on. On this slide, we're going to talk more about who does what. Just now we looked at the different kinds of doctors. Try to remember them. Can you put the right doctor into the correct sentences? Okay, have a go first. Pause the video, see whether you can guess the correct words. Okay, let's have a look together, shall we? So the first one, somebody specializes in dealing with health problems in children. Do you remember who this is? This is a pediatrician. Number 2, if you suffer from blurred vision, you may need to see what kind of doctor? Somebody who specializes with eye problems. This is an optometrist. Okay, number 3, this person helps to check whether you have any internal body damage, especially related to your bones. So he or she is a radiologist. The next one, number 4, somebody who specializes in general health problems related to the body is called a general practitioner. And the last one, serious procedures such as heart transplants are carried out by surgeons. Okay. Let's take a look at inside a hospital. A hospital is a very huge place. There are so many different kinds of departments and different types of rooms. Here are 6 examples of different places that you might see in a hospital. The names of these places are at the bottom of the screen in the grey box. Let's read out these names first before we match them to the pictures. So starting from left to right, first one is the operating room. The next one, intensive care unit, or ICU for short. The blood testing lab, radiology room, consultation room, and the recovery room. Okay, so 6 different rooms. Let's match them to these pictures. So picture number 1, what's this place, do you think? This is the intensive care unit. So here in this place, patients who have serious conditions, they will be resting here because their condition is very unstable. So it might change at any time. Maybe 1 minute they are quite stable, but then the next minute they're in a very serious condition. So the doctors and the nurses, they have to always keep an eye on this kind of patient and monitor their condition. Picture number 2, top middle. Where is this place? So this is the operating room or operating theatre. And this is where the surgeon works. He will conduct his operations in this room. Next to the operating room, here we have the recovery room. Okay, so normally after patients who are in the ICU, if their condition becomes stable again, and they no longer go back to a serious condition, then they can rest in the recovery room until they get better. Down here, bottom left, where is this? This is the radiology room. This is where the X-ray scans are carried out. Next to that is the consultation room. And this is where the general practitioner works. He will see patients in this room and do any checks and give advice as well. The last one, this is the blood testing lab. So sometimes in the hospital, you might need to give your blood sample to the doctor, and this is where they will analyze your blood sample to determine any cause of illness and things like that. Okay, so these are some places inside a hospital. Can you think of any other places that we haven't mentioned? Okay, so we looked at places. Let's take a look at some common health problems. Here on this screen, we have the problems on the left-hand side in black, and then the meanings on the right-hand side in blue. Let's see whether you can match them correctly to each other. Okay, if you want to try yourself, pause the video now. Okay, let's have a look at this together, shall we? So the first one is migraine. Migraine. What's a migraine? A migraine is, we can think of it as a more serious form of a headache, like a big thumping headache, very, very painful. Indigestion. What's an indigestion? This is a stomach ache. Okay. Maybe you ate something that wasn't very clean or very fresh. You might have indigestion. The third one is flu. Flu is like a serious cold. What's the difference between a cold and a flu? Colds usually last for 2 to 3 days. They're not very serious, whereas flus last a bit longer, a week, sometimes 2 weeks, right? Flus are caused by viruses in your body. Fever. What's a fever? If you have a fever, it means you have a high temperature. Your head and your body gets very hot. You feel very uncomfortable. Diarrhea. Diarrhea means you have the constant need to go to the toilet. So maybe just like a stomachache, you ate some food that was not very clean or was not very fresh, and after a while you feel some stomach problems and you need to run to the toilet constantly to feel better. The next one is a broken bone. What's a broken bone? This relates to some kind of internal body structure damage. So for example, broken arm, broken leg, something like this. Backache. A backache is a pain just behind your waist. And short-sightedness means a problem seeing things at a distance. So in other words, you are unable to see very far away without wearing glasses. Some people have the opposite condition where they cannot see very close, but they can see very far. We call this long-sightedness. Okay, so here are some different kinds of health problems. Now, if you are watching this in a group, just talk to your partner and discuss some of the things that you should do for each of these problems in order to get better. Okay. On this screen, we're going to look at some tools that some doctors might use when they do their job. And the names of these tools are at the bottom. Let's read these out first, shall we? The first one is X-ray machine. Next, mouth mirror. Stethoscope. Stethoscope. Retinoscope. Retinoscope. Test tube. Mouthwash. Scalpel. And syringe. Okay, can you match these words to each of these pictures correctly? Let's try together. So starting from A, what's this? This is what we call a scalpel. Okay. Picture B is a retinoscope. Picture C is a mouth mirror. How about picture D? What's this? This is mouthwash. And then over here, picture E is a test tube. F, this is the X-ray machine. G is the syringe. And the last one, H, this is the stethoscope. Okay, so these are the different tools different doctors might use in their job, but do you know what they use them for? Okay, let's talk about this. So the scalpel. The scalpel is used by, for example, the surgeon to do his surgery, right? Sometimes the surgeon will need to cut open a patient in order to access their internal organs. So a scalpel is used to do this. A retinoscope is used by an optometrist, and this tool is used to look inside a patient's eye to detect any unusual conditions. The mouth mirror is used by the dentist. So the dentist will use this particular tool to look deep inside your mouth and also to try and see the teeth right at the very back of your mouth, and also the underside of your teeth as well. How about the mouthwash? What's this for? So after the dentist cleans your teeth, then the patient will usually use mouthwash to rinse their teeth. The test tube. So the one use of the test tube is to use it to contain blood samples. All right. So for example, the people who work in the labs, they will use these test tubes and they will analyze the samples inside the test tubes using the various machines and equipment that they have. Next is the X-ray machine. So we know that the X-ray machine is used to look inside your body, right? Usually it's used to look at your bone structure to see whether there are any breaks, but sometimes they can also be used to look inside your chest, maybe your lungs as well, to try and detect if there's any kind of infection. The syringe is a needle which is used for either drawing blood, okay, or giving a patient some kind of medicine, okay. For example, some patients, before they have an operation, they might be given a very special type of medicine called an anesthetic. Okay, so what this does is it will make that part of their body numb, so that when the surgeon operates on them, for example, when they cut them open, they won't feel the pain. And the last one, stethoscope. This is a very common tool used by general practitioners and other doctors, and they use this to listen inside your body. So they can listen to your breathing patterns, they can also listen to your heartbeat as well. Okay, let's have a look at some questions that the doctor might ask you when you go to see the doctor? First of all, why does the doctor ask you so many questions? Okay, so the point is they want to diagnose clearly exactly what the root cause of your problem is, because sometimes different problems might have similar symptoms, right? So it's very important for the doctor to know exactly what the problem is so that they can give you the right advice and right treatment. Now, here are 7 examples of some questions that they might ask you. Some of these words are missing. The missing words are at the bottom of the screen. Let's read these words out. First of all, from left to right, medication, exactly, sleeping, felt, everything, matter, pain, eat, taken, way. Okay. If you want to try first, pause the video now and have a go. Okay, let's have a look at this together. Number 1, the question here is, what's the matter? Number 2, where exactly is the pain? Number 3, how long have you felt this way? Right. The next one, have you taken any pills or medication? What did you eat yesterday night? Is everything okay at work? Have you been sleeping well recently? Okay. So these are some quite common questions that the doctor might ask you to try and determine exactly what the problem, what the cause of the problem you have is. Next, let's look at some other health vocabulary. This time, we have the words on the left-hand side, but some of the letters have been covered up. On the right, in blue, these are the corresponding meanings, the definitions. So let's read the definitions and see whether you can guess these words on the left. Okay. I will read them out and let's see whether you can guess. So the first one, you feel something uncomfortable inside your chest, and you do this to force the air out to make yourself more comfortable. So in other words, you're doing something like this. So how can we describe this kind of action? We call this a cough. Okay, cough, coughing. The next one, the front part of your neck that you use to speak hurts. So this area here, this area hurts. This means you have a sore throat. Red spots develop all over your face. Can you remember this one? You have red spots all over your face. This is measles. Measles. You feel really cold that your body starts shaking. Okay, so you're shaking. What's this? You have the shivers. The shivers. A sharp object has penetrated your skin and is causing that part of your body to bleed. So to bleed means blood is coming out from that part of your body. What's happened? You have suffered a cut, or you have cut yourself. Maybe you were cooking and you were chopping some vegetables, but you accidentally cut your finger by mistake, and now it's bleeding. The next one, after knocking or bumping a part of your body, you will see some black and bluish, sometimes yellowish spots appear. And this is what we call a bruise. Okay, sometimes if you play some sports that you need physical contact, like football, for example. You're always bumping into other people. Sometimes you're falling onto the ground. So after the game, you might find that you have a lot of bruises around your body. But normally, your bruises will disappear around about a week or so later. The next one, a pain in your mouth. The pain is in something that you use to eat. What's this? This must be toothache. And the last one, you always need tissues to blow a part of this body. This is a runny nose. Runny nose. Okay, now here are some role plays that you can try with your partner. So we've got 2 role plays, right? The first one is between a doctor and a patient. Let's just read out the description here. So the doctor, whoever is the doctor, a patient is coming to visit you with some health problems. What you need to do is to ask them some questions to find out exactly what is wrong with them. And then once you have all of this information, you can give them some useful advice. If you feel that they need to take some special medicine, then you might need to prescribe them some medicine as well. Okay. For the patient, you don't feel so good today, so you have decided to see the doctor. At the doctor's, tell the doctor how you feel and answer any questions that they ask you. Also ask the doctor for some useful advice about how to get better. Okay, this is the first role play. The second one, you can choose which one you want to do. The second one is between a boss and an employee. All right, and in this situation, for the boss, your employee is calling in sick. But this is not the first time it's happened. This is the 3rd time this month. So you are very suspicious. You think that they might not really be sick. So you need to ask them some questions to find out exactly what's wrong with them, and then decide whether or not to give them a day off to recover. All right. For the employee, you have a terrible hangover. Hangover means a terrible headache from drinking too much alcohol. And so you've been drinking until late last night. You really don't want to go to work today. Call your boss and tell them how you feel. All right. Ask your boss to take a sick day off. If your boss asks you any questions, make sure you answer his or her questions, but you may choose to lie if you want, okay, because your objective is to try and take a sick day off. All right, have a go. All right, have a go at these role plays and try to use some of the language that we looked at earlier about different health problems, questions that the doctor might ask, and phrases like that. Okay, here we have 10 sentences, and what you need to do is to just say whether you agree or disagree with them. All right, if you're watching this in a group, you can pause the video now and do this together with your partner. Don't forget to give reasons why you agree or disagree, okay? Okay, guys, that was the last slide. So thank you for coming to my English Corner. Hope you enjoy learning about doctors, hospital, and health problems. For now, see you next time and have a good day. Bye-bye.